The next whole body image from case number 33 is from a patient with history of melanoma. The whole body image shows multiple foci in the lower neck, chest, and also in the abdomen. These hypermetabolic foci correspond to a metastatic focus in the region of the paraspinal muscle in the right supraclavicular region, another focus in the right supraclavicular region, hypermetabolic left lung nodule, and also involvement of right-sided paraspinal muscles at the level of the lumbar spine. Another patient with history of melanoma, case number 34. We have a hypermetabolic focus down here in the pelvis. There's urinary bladder activity and there is some activity in the rectum. The focus in the pelvis corresponds to this fluid collection and peripheral hypermetabolism seen in the right inguinal region. This is inflammatory uptake from a seroma that developed after sentinel lymph node biopsy in this region. There was no evidence of metastatic disease seen. Case number 35. Patient with history of metastatic lung cancer and a focus in the head and neck region and a focus in the pelvis. The focus in the head and neck region corresponds to this slightly hyperattenuating and hypermetabolic tumor in the left parotid. This turned out to be a pleomorphic adenoma. Benign parotid tumors are frequently seen as incidental hypermetabolism on whole body PET-CT images. There is also asymmetric increased uptake in the right tonsil compared to the left with some soft tissue fullness. This was biopsied and there was hyperplasia that was found on biopsy. Here is the focus in the pelvis, and this was further evaluated by colonoscopy and an adenomatous polyp was removed. Case number 36. Patient with history of head and neck cancer, primary seen up here at the edge of the field of view. They also have multiple foci in the chest and intense linear uptake involving the entire colon. Here is the appearance of the primary on the right side involving the tonsil, seen here on the fused PET-CT image. They also have multiple foci in the chest, seen as hypermetabolic lymphadenopathy in the prevascular region, AP window, and also the subcarinal region. And there is linear increased uptake corresponding to a featureless lead pipe appearance of the colon showing diffuse mural thickening consistent with colitis. Next case, patient with history of lymphoma, and the image on the left is a whole body image showing predominantly bone involvement, and the image on the right is showing post-therapy image with complete response to treatment. Case number 38, before and after images in a patient with history of lymphoma. Oops, looks like none of my videos are ready to work. Anyway, hypermetabolic lymphadenopathy in the abdomen and pelvis with complete response to treatment. Case number 39. This whole body image shows linear hypermetabolism involving the paraspinal muscles in the thoracic and vertebral spine. There is no focal hypermetabolism to suggest neoplastic involvement. and these images are showing the paraspinal muscle uptake in a better view, the right lateral, left lateral, and the posterior image. The paraspinal muscle uptake was secondary to muscle spasms, as the CT sagittal image shows a compression fracture involving one of the vertebral bodies. Case number 40. Moving too fast. Here we see symmetric foci of hypermetabolism involving the chest, the left, the right, and the left hilar regions in a patient with sarcoidosis. Case number 41. Patient with history of medullary thyroid cancer who presents with a new nodule in the right side of the neck. The contrast enhanced CT of the neck shows this nodule adjacent to the right submandibular gland, and here is an image from an ultrasound guided biopsy which proved that this patient had medullary or metastatic medullary thyroid cancer. Remember, medullary thyroid cancers are neuroendocrine in origin. They arise from the parafollicular or the C cells that secrete calcitonin. So we measure calcitonin as a tumor marker in those patients after the primary has been removed, and when the calcitonin is rising, we can either do a FDG PET CT scan. These tumors are hypermetabolic, so they'll take up FDG. We can also do indium-111 octreotide scan to look for metastatic disease. They frequently go to the liver, and in that situation, an MRI of the liver using EOVIST would be a better modality to assess liver metastases. So this patient underwent a whole body FDG PET CT scan. The whole body image is seen here. Here is the focus that was seen in the right side of the neck, and here is another incidental focus that was picked up in the liver. So focal hypermetabolism in the right submandibular region consistent with the known metastatic disease, and a new metastatic focus in the liver, which is seen right here. Patient with history of thymoma. We are looking at multiple images from their PET CT showing mild to moderate hypermetabolism seen here. And here is the appearance of thymoma, low attenuation and barely any enhancement on the contrast enhanced CT. And here is an image from a CT guided biopsy. So thymoma showing mild to moderate hypermetabolism on FDG PET. Case number 43. Patient presented with swelling in the right side of the face. Here is a contrast enhanced CT showing a ill-defined tumor with enhancement, mainly peripheral, involving the right parotid with central hypoattenuation, and the PET CT scan shows focal hypermetabolism. This was biopsied and turned out to be a parotid adenocarcinoma. Next case, 60-year-old female with history of colon cancer and lung cancer. They presented with hypermetabolic lymphadenopathy in the abdomen, seen here on the whole body image and seen here on the fused PET CT image, and this was biopsied, as you can see here, from a CT guided biopsy, and it turned out to be a poorly differentiated colon cancer. Next case, a 92-year-old male with history of left cheek squamous cell cancer presented with a left neck mass and a liver lesion. So here is the whole body PET CT image showing the recurrent tumor in the left side of the neck, the squamous cell cancer, and a incidental focus in the liver. The liver focus was biopsied and it turned out to be hepatocellular cancer. Case number 46, a 54-year-old female with suspected liver metastases. On the whole body PET CT image, the liver is enormous. It's enlarged, and it is full of hypermetabolic tumors, which is seen here on the fused PET CT image and on the contrast enhanced CT image. This was biopsied and it turned out to be a multifocal HCC. Case number 47, a patient with history of multiple myeloma. Whole body image showing multiple foci of hypermetabolism involving the bones, and a focus in the liver, which is seen here, and there is another focus that is seen here on the whole body image. So these hypermetabolic bone lesions corresponded to lytic expansile foci in the bones, and the hypermetabolic foci in the liver. One of them was biopsied and turned out to be a plasmacytoma. Next case, patient with history of breast cancer. The whole body image before treatment seen here on the left, showing the mass in the left breast, axillary hypermetabolic lymphadenopathy. Patient was treated with chemoradiation, good response to treatment, which we see here. The image on the right showing complete response with resolution of the focus in the breast and also in the axilla. There is, however, now diffusely increased bone marrow activity. This is secondary to bone marrow expansion from chemotherapy, and this finding can also be secondary to bone marrow stimulators such as GM-CSF. Next case, patient with history of Whipple's procedure, presented with a FDG PET-CT scan. On the whole body image, the interesting finding is seen right here at the surface of the liver. There is linear mild to moderate hypermetabolism. On the coronal image, this is its appearance, and look at the CT, there is some soft tissue thickening around the liver consistent with peritoneal disease. Case number 50. The image on the left is before treatment. This patient has metastatic neuroendocrine tumor. We see multiple metastases in the liver. The liver is enlarged, and this patient was treated with 4 cycles of 200 millicuries of lutetium-177 dotatate, and the follow-up scan on the right is after the 4 treatments. You can see that the liver is now normal in size. The hypermetabolism seen in the liver metastases has significantly improved when compared to before. The uptake in the right shoulder is inflammatory / post-traumatic. Another interesting case, number 51. This patient initially had a bone scan to look for bone metastases, and these multiple foci localized to the pelvis and another area of multiple foci localized to the left side of the chest were reported as suspicious for metastatic disease. And so this patient underwent a FDG PET-CT scan. These are 2 images from the PET scan. CT showing sclerosis and fracture involving the acetabulum / pubic ramus seen here with focal hypermetabolism. And look at their, these are the numbers from their bone density scan. Their BMD, the T-scores are less than -2.7, making these insufficiency fractures which are hypermetabolic on PET, and they are seen on the whole body bone scan. This patient was suspected of having a tumor in the left ventricle. Their echocardiogram showed an enlarging mass in the region of the apex, and a PET scan was performed to see if there is any hypermetabolic tumor. There is no hypermetabolism on this whole body image. The most common tumor inside a ventricle is a thrombus, and here we see the thrombus as a hypoattenuating focus with photopenia on the FDG PET-CT image. So this is apical thrombus. There is no evidence of tumor. Next case shows a FDG PET-CT scan in a patient with lymphoma. We have multiple lymph node groups in the neck, chest, abdomen, and pelvis showing hypermetabolism. Look at the spleen. It's diffusely hypermetabolic than the liver, suggesting lymphomatous involvement. Also, there is heterogeneous increased uptake in the bone marrow, also consistent with lymphoma. And look at the post-therapy image. There is complete response to treatment, and there is no evidence of residual hypermetabolism. Case number 54, another interesting FDG PET-CT scan. Here's a whole body image showing a focus here in the pelvis. You can see some symmetric breast tissue in this young female. There's also some focal stasis in the right distal ureter. The focus in the pelvis corresponds to intrauterine cavity, and this is physiologic activity during menstruation. Last case for this teaching file, patient with history of bone metastases. The 2 images are coronal PET image and the coronal CT image before treatment, and the 2 images on the right are after they were treated with chemotherapy. Initially, it showed hypermetabolism, but after treatment, there is bone marrow expansion, so the bone marrow is diffusely hypermetabolic, but the focal hypermetabolism in the bone metastases has resolved. Look at it. Look at no change in the appearance of sclerotic bone metastases before and after treatment. So good response to treatment of bone metastases. So those are some of the common, interesting, and rare findings that we can see on whole body FDG PET CT imaging. Thanks for watching.